Hello there. Are you here for an eye exam? Perfect timing. Please, come on in and make yourself cozy. Just take a seat right at the chair. Yes, about 1.5 meters from me. Perfect. And could I get your name? Okay. And is that spelled? Okay. I see you're right here. And just to double check, could I get your birthday? Okay. Okay. It seems that we have you here today for a general eye examination, as well as a very detailed orbital exam. Good. I am Dr. Retinal. Pleasure to meet you. And I do welcome you into my office. Of course, we have all of the basic information for your eyes. Now, just going to take a look at you. If you could keep your focus on me. I'm going to just move my eyes around, looking at your eyes. Just keep looking at me. Have you had any problems recently with your eyes? Okay. And have you been experiencing any problems with past prescriptions for glasses or contacts? Okay. As well, have you been getting any headaches, vertigo, double vision, migraines? I'm gonna get some gloves on. And have you ever had your orbitals examined before? Okay, so it's not something dramatic. Your eyes run off of orbitals. And directionally speaking, if you have a problem with one of your orbitals, it could mean that your vision could be impaired. So, taking a look over here, we're going to be examining the retina first, okay? And going to be using a pen light. Are you comfortable with this? Perfect. And may I touch your face? Good. If you could keep looking at me. Lovely. I'm just going to carefully just touch the side of your face here. And I want you to just look at my nose. Just focus on my nose. Okay. And is that a bit too bright for you? Are you okay? Good. Look back at my nose. Okay. Let's take a look at the other side. Look at my nose. Is the light too bright? Okay. Okay. And have you been feeling any pain within your eyes? Okay. Okay. Good. Now I'm going to get a bit close, I apologise, but I want you to try and focus just at the poster right here. Okay? I'm going to get just a bit close. Focus on, if you can, on the area with the poster. I do see that with your eyes, you may have a bit of light sensitivity, and that's okay. I just want to know if that bothers you, and if you've been having any problems staring at a computer screen or a phone for too long. Okay. So, I'm gonna look into that. I'm gonna get close again. If you could look just off to the shoulder. I'm gonna get just a bit closer and take a look to your eyes. And I see no redness or irritation, but I do see your eyes reacting quite strongly. Okay. I'm gonna turn the light off for just a bit. So first, sometimes people dislike this part, and sometimes people don't mind, but I'm just going to enlarge your pupils with a couple of eye drops, okay? This is going to better help me see into your eyes. So, if you could please just look up for me, okay? I'm just going to get right next to your eye and look up. Here we go, just a bit. 1, 2, and 3. And if you could blink for me. Good. To the other eye, look up. Good, and 1, 2, and 3. And if you could just blink for me. Perfect. I'm going to take a tissue. Just going to pat away the excess. Just going to pat away the excess. Okay. You all good? Good. And what this is going to do again is to widen the pupils. And I can actually take a better look inside your eyes and examine your orbitals. Moving on to the orbital exam. We take a look up here. We're looking at the anterior eye. First, I'm going to be looking at some of the glands in your eyes. And these help with your muscles, muscular function, and movement of the eye, okay? So first I'm going to do a pressure examination. Just going to put pressure along different parts of your eye. And you let me know if it feels okay or if it's bothering you. Good. So, I apologize for getting a bit close, but I'm just going to first apply pressure right at the outsides of the eyes. Okay, and does that feel okay to you? Okay, right there. And above. Just above, right there. Above, right there. Okay. And are you feeling any pressure on the eye that's uncomfortable? Okay. Now onto the upper eye, okay. Just a bit of pressure like that. Okay. And release. Okay, and now under the eye. And just look up. Good. Any uncomfortable pressure? Okay. Good. Nothing incorrect with the orbitals. Okay. Now, going to take a look at the muscular structure on the orbitals with a magnifying light. So, I'm just going to lift up your eye and take a look at your muscles, okay? Good, and let's make sure this works. Great. I'm just going to lift up your eye and take a look. If you could look up for me. Good. Look down. look at the bottom lid. Just going to move that down once more. Take a look right at the bottom muscular structures of the eyes. Okay. No swelling, or sometimes you can see infection, which can cause visual problems and can cause pain. Onto the other eye. Okay. So I'm going to take a quick look back, lifting the top part of your eye. We're just going to take a look here, okay? You could look up for me. Good, look down. To your left and then to your right. Perfect. And then if you could look it down once more. Good, okay. Now just going to do the same thing. Look down. Good, to your left and right. Good, okay. If you could carefully follow the light. Good. Good. Okay. I'm going to get a bit close. Putting this right up to your eye. Is that a bit too bright? Okay, on the other eye. And is that a bit too bright? Okay. This also means that the eye drops are working. Okay. Now, I'm going to bring the pen light back. I'm going to do something called an orbital light exam. I'm just going to ask you to follow the pen light to the best of your abilities with just your eyes. Okay? So, got the pen light again. Just follow it with your eyes, okay? Good. So, you can clearly see the pen light, yes? And if you could focus your gaze right onto the pen light. Good. And then follow. Good. 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 Now I'm going to just test the orbital, so we're going to go around the perimeter of the visual field. Good. Great. Good. Good. Did that bother your eyes at all? Okay. Now I'm going to shine it onto your eyes and you let me know when the light appears to be at its brightest. Okay? So, about here. Okay. And once more. There. Okay, and there. And there. Okay. Going to start up and down. So, tell me when. There. Okay, perfect there. Okay, and there. And there. Perfect. Thank you. So, I'm just going to make sure that that's written down. And are your eyes feeling a bit heavy? Sometimes when we apply the pupil dilation drops, your eyes can feel a bit tired, and you can start feeling a bit tired too. Yeah, that's normal. If you feel like you need to take a nap, you can. A lot of people end up doing that anyways. So, now we're going to do something called an orbital peripheral check, and it's to check for blindness around the orbitals, okay? So, going to use a prism, and it's a lens to test to see if you can see the perimeters around your eyes, and this one is known to imitate no light. So let me know if you're able to see this prism next to your eyes or not, okay? Good. So this is to test for partial or total blindness around the eyes, and all we're going to do is just put it around your eyes, and you let me know when you can see it, or if you can see it at all. Okay, let's begin. First with this left eye, okay? Let me know if you're able to see it. Okay? Good. 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 Okay. And here. Okay. Interesting. And there. Okay. There and there. Okay. Tell me, can you see this right between your nose? I'm going to place it on your nose. Can you see that? Okay. Let's test the opposite direction now. Okay. And do you see that there? Okay, what about here? Okay. Here. What about there? And there. Okay. Good. 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 Okay. Good. Now I'm going to completely cover one eye. You let me know if and when it covers the eye completely. Perfect, right there. Good. And onto the other eye. And when does it completely cover the eye? Right there. Good. Now we are going to do something called an orbital red saturation test. And this is another prism that we can just place over the eyes that gives the illusion that everything is red. Do you have any color deficit to red? Okay. Okay. I actually have a lot of color deficit to orange, and there's different types of pinks and purples I'm unable to see, so don't be ashamed if you cannot see the color difference, or if you can see the color at all. Okay, so I'm going to place this over one of your eyes. You let me know if there's a difference or not. Do you see the color red? Okay. To the other eye. I'm going to place this. Okay. And do you see the color red? Okay. And is there anything else that's a different color other than red? Okay. And if you do, what is it? Okay. Understandable. And does this color make you feel any different with your vision? Better or worse? Okay, lack of detail, I see. Thank you. And now, a quick accessory test. I just want to ask you what type of vision you see, and if it has affected your vision at all. And I'm going to place the first one on. Is there any difference with your vision, or is it exactly the same? Okay. And then one more. Here we go. And is it exactly the same or not? Okay. Just going to check that. And last but not least, I'm going to use a very small magnifying glass. And I'm going to just take a look into your pupils and into your retina now that I have your eyes properly dilated. So, I'm going to just place this on one of your eyes. Okay. I'm going to shine a bit into it. Now, it might be a bit blinding, especially after the eye drops once more. You're doing good. 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 Blink. Good. That was the first time. To the other. Okay, so just going to get that down. Just look at my nose. Good. Blink. Blink. Good. And let's check the orbitals one more time. And relax. Blink. Blink. Very good. So, going to give you the soothing treatment for the eyes now. It's to help them stop with the longevity of the eye dilation. As your eyes appear to be in good health, sometimes that's not the case with some people. May need to do more exams on them. So, just going to apply some drops to stop them from continuing. So, look up. Going to go just 1, 2. Good, onto the other eye, look up. 1 and 2. Very good. Let's clean it up for you. Just going to pat that away. Over here, we're just going to pat your eyes, making sure there's no more of the eye drops. Just going to pat. Okay, look at me. Very good. Now, I'm just going to set up the pulse here. Okay, so for you in particular, I think that the only thing that could be of concern with your eyes is brightness, sensitivity to light, and this could be due to a lot of things. Perhaps you're outside for a little too long and the sun gets to your eyes. Perhaps you are working too long on your computer. You need to just make sure that you are wearing blue lens protectors for your glasses, or getting a pair yourself. It'll actually help reduce eye stress and eye strain from when you're looking at blue light, things such as your phone or the computer. Okay? Exactly. Now, I hope you have an amazing day. Please come back when you need your next exam. And I'm going to be sending your reports in, sending you a prescription for a pair of glasses that will protect you from the blue light on your phone and on your computer, okay? Good. Thanks for being here. Again, I am Dr. Retinal. If you have any more problems or you just want to come in for another exam, let me know. Call and schedule and I'll be here for you.